from our neighborhood in Tanzania. We are lucky that you didn't speak Kiswahili because we would have needed a translator. Distinguished guests, ladies and gentlemen, Kenya's commitment to universal health coverage rests on a simple but powerful truth. Every life matters. Today, we reaffirm that commitment by strengthening the partnership that protect our people and protect our region. Kenya and WHO have stood together through outbreaks, pandemics, recoveries, and rebuilding, forging a partnership defined not just by projects, but by shared capabilities in early warning systems, national surge teams, strategic reserves, and digital systems that turn data into life-saving action. Because of this collaboration, fewer lives are lost, recoveries are faster, and confidence across the continent continues to grow. The advanced life support ambulances will be handed over to all our 7 national referral facilities and the National Emergency Response Center of the Ministry of Health. In addition, the counties of Elgeyo Marakwet, Marsabit, Siaya, Samburu, and Tana River will benefit from similar vehicles that will support reproductive and maternal health services. This support goes to the heart of our universal health coverage agenda, advancing safe pregnancies, healthy mothers, thriving newborns, and responsive systems. The new resources will strengthen emergency referral care, improve oxygen capacity, reduce maternal and newborn deaths in high-burden counties, and sharpen our readiness for cholera, mpox, and other public health threats. Their true value will not be measured not in numbers, but in mothers saved, babies supported, and communities strengthened. Yet maternal and newborn mortalities in Kenya remains unacceptably high. No woman should die while giving birth, and no baby should be lost to preventable causes. The Ministry of Health is under firm and strict instructions to deliver rapid, measurable reductions through real-time reporting of every case, timely clinical audits, and immediate corrective action at facilities and at county levels. I have agreed with the Ministry of Health team that, as I have said, the maternal and child mortality is unacceptably high. We cannot be losing upwards of 300 in 1,000, in 100,000, while the benchmark is 70. I mean, it is completely unacceptable. And going forward, we have agreed with the DHA is going to provide data, and every facility in Kenya, public or private, every facility must provide data on mothers and children who die in their facilities. I know that there are facilities that continue to hide data on mothers who die or children who die in hospitals. We must get the data right, because we must get our act together and reduce the death of mothers and children, especially at birth. I have asked the ministry to conduct an RRI, and the Director General at the ministry has given us an undertaking that by March next year, we will have the correct data on what is our performance as a country, county by county, and then we can therefore be able to respond to this big challenge effectively. I was very embarrassed when I was confronted in New York by a good friend of Kenya who asked me, Mr. President, how is it acceptable in Kenya that upwards of 300 mothers and children die in our facilities? And it is something that has bothered me very much. I know I have discussed this extensively with many of the governors, especially in the counties that have the highest mortalities. And I'm happy that today we are providing facilities for the counties of Tana River, Garissa, Samburu, Marsabit, Siaya, and Elgeyo Marakwet. These are the counties that have some work to do. And we are going to work with the leaders in these counties. The governors and the ministry will provide supportive mechanisms to make sure that we correct what is going on in our facilities. We will intensify the every woman, every newborn, everywhere agenda by equipping frontline teams, securing essential commodities, and ensuring respectful, high-quality care at all levels. Because this is a continental challenge, I also call on the World Health Organization Regional Office for Africa and all partners to work with us to reverse these statistics and strengthen regional health security. Partnership is our greatest advantage, and together we must scale up what works faster. To reinforce this collaboration, I urge